The smile zone is among the most difficult area of the mouth when it comes to replacement of missing teeth. And this is because they're right in the front and any loss of bone or soft tissue becomes easily visible. Such tissue remodeling is even more significant when replacing adjacent central and lateral incisors. So how do we preserve the bone and gum tissue during implant therapy and get the best aesthetic outcome? I'm Dr. Ryan Kazemi, and welcome to Hints and Tips in Dentistry. What makes implant replacement of missing adjacent central and lateral incisors a bit challenging is a tendency to get tissue resorption, both in the front of the tooth as well as in between, which can result in poor aesthetic outcomes. So when we have to extract such teeth as in this patient, we have to have a strategy to preserve the tissues as best as we can, not only at the time of extraction and afterward, but also when the dental implants are placed. So our main goal is to minimize changes in the gum line and preserve the little tissue in between the teeth, which is called the papilla. And if we do this right, we hope to achieve a result like this: natural appearing teeth that look like they're emerging right out of the tissue. So how do we preserve the bone and soft tissue? Let's look at some of the strategies that helps us to do that. First, atraumatic extraction, removing the tooth as gently and as minimally invasive as possible. The second is a concept called partial extraction therapy. We'll talk more about this. The third is placement of dental implant immediately at the time of extraction, which helps to support the bone and soft tissue as well. Fourth, placement of one implant with two restorations. And we'll describe the reason behind the biology behind that decision. Bone graft, soft tissue graft, as well as fabrication and design of prototype restorations and anatomical final restorations that mimic nature. Let's take a look at each one. The first is atraumatic extraction. What that means is that the tooth should be removed as gently as possible in order to avoid any disruption to the surrounding bone and soft tissue. A variation and a modification of this technique that has been emerging for the past few years is called partial extraction therapy. It's a technique that allows us to intentionally leave parts of the tooth in place to maintain the bone and soft tissue intact. And there are basically two types of partial extraction therapy that we utilize. The first is known as socket shield. With socket shield, we leave a thin veneer of the root of the tooth in place in the front, which will maintain the bone and soft tissue in that location. The second is known as submerged root therapy, in which we actually submerge the entire root of the tooth in the socket. And we do this in the areas where we're designing what's known as a pontic and not planning to do dental implants. So we will talk more about the partial extraction therapy and how we use it in the case that we'll describe. The second strategy to preserve bone and soft tissue is placement of dental implant immediately at the time of extraction. Of course, this is only done when possible and may not be appropriate for every patient. But when we can, the implant itself can help to preserve tissue and bone and minimize the resorption and the remodeling. Next, the strategy of placement of one implant restored with two crowns. What this means is that we place one implant, in this case in the central incisor, and the lateral incisor is restored with a cantilever crown. Essentially, it's a pontic. It's a fake crown that connected to the crown supported by the dental implant. The reason we do this is because of the biology that we understand in terms of preserving the tissue. It's much more difficult to maintain that papilla in between two dental implants if we have inadequate distance in between, hence why the strategy of one implant with cantilever crown is quite effective in these cases. Next is bone and soft tissue graft. What this means is that at the time of the extraction, we place some minor bone graft to preserve the socket. Also, at the time of implant placement, we often place a soft tissue graft to make up for any resorption changes that may have occurred, but also to maintain and preserve a thicker soft tissue that can add longevity to the implant and a more stable outcome over time. Next is design and fabrication of anatomical prototype and final restorations. The prototype restoration is basically a transitional or provisional restoration that is used to design the soft tissue while the implant is healing and before the final restoration is designed. It's incredibly important that we have abutment and restorations that are anatomically designed and placed in order to be able to support the soft tissue and bone that has been already designed and made in place. So here are my tips on how to preserve bone and soft tissue when replacing adjacent central and lateral incisors. First, very important to perform an atraumatic extraction of the central incisor, as in this case. Of course, conventional extraction technique can be done in an atraumatic, non-invasive approach, but more and more, if we can use a partial extraction therapy using the socket shield technique, it'll be more effective to avoid those remodeling changes. Second, atraumatic extraction of the lateral incisor in this particular patient. Again, using the partial extraction therapy, specifically the submerged root therapy when possible. This may not be indicated or possible in every patient, but when we can, is the most effective way to preserve the socket and avoid those tissue changes. Third is the guided immediate implant placement on the central incisor, if possible. There are times that we have to stage the implant placement once the area is healed. That is a decision that is made by the surgeon depending on the foundation, the health of the bone, and a number of other factors. Next, to place a bone graft, whether in the socket or in the gap between the implant and the bone, if an immediate implant placement is performed. Next, soft tissue graft when indicated and necessary. And finally, the anatomical prototype and final restorations. So these are my main tips on how we can preserve the tissues in this type of scenario. Let's take a look at this same patient where the first thing we do is a three-dimensional digital planning for precise implant placement. We do a digital design of the restorations. We virtually place the implant in the software and design and fabricate a surgical guide. Next, the implant is placed. This particular case, we could not do the partial extraction therapy on the central incisor, the socket shield as we had intended, just because of the extensive decay on the tooth. So a conventional extraction was done with minimally invasive technique, immediate implant placed, and a minor bone graft was placed. For the lateral incisor, however, we were able to do a partial extraction therapy using this submerged root therapy to preserve the soft tissue and the papilla in between. This area is allowed to heal for about 3 to 4 months before it goes into a prototype restoration and a final restoration. And we have an implant crown, which is supported by the implant itself, and the cantilever crown, which is connected to that restoration, essentially with a pontic design to create the effective illusion that the tooth is coming out of the gum tissue. And this is again, the final outcome. And we can see that 2 different techniques were used for each site. One with the extraction, immediate implant, bone graft, and a soft tissue graft, and the lateral incisor with a partial extraction therapy with a submerged root. So again, to summarize my tips for how to preserve bone and soft tissue when replacing adjacent central and lateral incisors is to make sure we perform atraumatic extractions and, when possible, use partial extraction therapy, either the socket shield or the submerged root therapy. Make sure that we have a total three-dimensional computer-assisted guidance on our implant placement. Must be accurate, must be precise, using surgical guides. Make sure that we bone graft and place soft tissue graft when necessary and indicated. And of course, to assure that we have anatomical, prototype, and final restorations. Remember, when replacing any teeth in the smile zone, make sure that you have a great team of a surgeon and a restorative dentist who can collaborate closely together and make sure that they have a proper surgical and a restorative plan to deliver the kind of results you expect. I'm Dr. Ryan Kazemi. See you again soon on our next Hints and Tips in Dentistry.